So you might be wondering, who qualifies for hospice? How do you qualify for the Medicare Hospice Benefit in the United States? If you're new to my channel, welcome. I'm Jane. I've served as a hospital chaplain for over 20 years and have been with thousands of people as they have transitioned into hospice. I've seen what hospice has to offer, and I've put together a playlist of videos on hospice. If you haven't done so already, please check it out. I will put a link in the description below. I'll be posting more videos on hospice, palliative care, and navigating everyday stressors, so be sure to subscribe so you can check out those videos as well. Thank you to all of my subscribers. You really have helped me so much. Without you, I would not be doing this work, so thank you for subscribing and joining the Chaplain Connect community. So, who qualifies for the Medicare Hospice Benefit in the United States? Well, right off the bat, I want to just say that the guidelines for who qualifies specifically for the Medicare Hospice Benefit do not always seem fair. If you are a United States citizen and over 65, then you generally qualify for Medicare, and you can get all of your hospice care for free, with the potential of just a few $5 copays for certain medications. So that's great, right? Well, not if you're 64. If you're dealing with the painful reality of having a terminal illness any younger than 65, then you do not qualify for the free Medicare hospice benefit. Now, there are some loopholes, so to speak, in this guideline that may get you the benefit even if you are younger than 65. You can still qualify if you are a United States citizen and you've been on disability for more than 24 months. Or you have ALS, which is also sometimes called Lou Gehrig's disease, or ESRD, which stands for end-stage renal disease. Now, if you do not fit any of these categories, then you can still get the majority of your hospice care needs covered by private insurance, if you have it, or state-issued Medicaid. Now, in many states, if you have a terminal illness, you can get onto Medicaid pretty quickly, especially if you have a really knowledgeable social worker you're working with. Private insurance and Medicaid usually do follow the Medicare hospice benefit rules, but they're not required to follow every rule, so definitely check with your insurance to see what is covered and what is not covered. So that's how you qualify for hospice from the insurance perspective, but how do you medically qualify for hospice? In order to medically qualify for hospice, your attending physician and the medical director of a hospice must document that you likely have 6 months or less to live if your disease runs its natural course. Now, doctors will often say that they do not have a crystal ball that can tell you the date and time of your death, and studies have shown that doctors often think you have longer to live than you actually do. But doctors can estimate how long you might live based on the research and their experience treating your particular condition. And when you're attending and the hospice doctor document that you have less than 6 months to live, this does not mean that you will die in exactly 6 months. You may have a lot less time or a lot more time than 6 months. In fact, when you enroll in hospice, you enroll at first for 3 months. You can renew another 3 months. And then after your 6 months on hospice, you can enroll for an unlimited number of 60-day periods. I've known patients who have lived for a long, long time on hospice, and some are so ready to move on to heaven that they'll say things like, "When am I going to die already?" Or I've called to check in on other patients who say things like, "I thought I'd go to hospice and die right away, but I feel better than I have in years. It's amazing." So you can live for a long time on hospice, so long as you continue to qualify. If you no longer qualify because you have had a miraculous healing, then you can also be discharged from hospice. This is not a frequent occurrence, but it does happen often enough that those of us who work in the field have coined a term for it. When someone has been miraculously healed and is discharged from hospice, we say that they have graduated hospice. Now, remember that the hospice medical director and your attending doctor must document that you have 6 months or less to live. So you might be wondering how you are involved in all of this, and who the heck is your attending doctor anyway? So your attending doctor is any doctor of medicine or osteopathy, any nurse practitioner, actually, or any physician assistant who has had a significant role in treating your illness. If you are able, you can decide who your attending doctor is going to be. Now, all of these decisions do not happen without you, though. In addition to your doctor's documentation, you also need to document that you no longer want curative treatment for your terminal illness or any illness that's related to your terminal illness. If you're mentally unable to make that decision, then your next of kin or your previously appointed healthcare representative would need to sign these documents. Your attending doctor and the hospice doctor cannot just ship you off to hospice without your consent. You and your loved ones are absolutely a part of the decision. So when it becomes clear to you, your loved ones, and/or the medical team that hospice may be a good fit for you, the medical team usually calls together a series of meetings called family meetings. They involve you and your loved ones, as well as your attending doctor and anyone else from the team that you would like to be there. If your doctor calls for a family meeting, you can absolutely ask that your nurse, your social worker, or chaplain be present if they are available. If you decide to enroll in hospice, the team helps set up a time to meet with the hospice nurse coordinator, who comes to you and takes you through the intake forms, which include a statement that you no longer want curative treatments. Now, it's really important to note that once you are enrolled in hospice, you have the right to leave hospice at any time. If you want to leave hospice, you must do so in writing with the hospice staff, but you have the right to leave at any time. That was a lot, so I'm going to quickly just recap for you. You qualify for the hospice Medicare benefit, which pays for hospice services in full if you are a United States citizen and are over 65 years of age, or you fall under one of 3 other exceptions. If you do not qualify for Medicare, then your private insurance or state-issued Medicaid will cover hospice. Your attending doctor and the hospice doctor must document that you have 6 months or less to live, and you must also document that you no longer want curative treatment for your terminal illness. Now, if you are going through this decision, my heart goes out to you. It's not easy. I hope that this video has helped you navigate an already difficult and sometimes really confusing decision process. If you have any questions, I really encourage you to reach out to your local hospital chaplain, or you can feel free to leave a comment below or reach out to us at mychaplainconnect.com. And I'll see you on the next video.